Okay, so hello everyone, and welcome to block 2 of today's workshops, where the topic is an effective strategy to save lives of adolescents and young adults. The title of this panel presentation is Youth Supporting Youth, Young People Making an Impact in the Mental Health Crisis. My name is Raha Masoudi. I use she, her pronouns, and I will be the moderator for today's session. A bit of background about myself is that I'm currently a research coordinator at Vancouver General Hospital, where my research interests mainly involve fentanyl, mental health, and healthcare system innovation. And I've been a research assistant under the supervision of Dr. Michael Kraus here with the Addictions and Concurrent Disorders Group for a few years now. I come from a neuroscience educational background from UBC, and I have been working with youth for a few years now as a crisis responder and a peer supporter. So I'm especially excited and feel very privileged to be the moderator for today's workshop on the topic of youth supporting youth. Without further ado, I'd like to introduce you to your incredible speakers for today. The speakers for today's session are Taliah and Zara Lyons and Gurkirat Nijjar. So Taliah is a founding member of Youth for Youth Canada and the project lead of Talk Overdose and Kazakh Indigenous cultural workshops. Taliah is also an incredible Indigenous artist whose artwork highlighting the opioid crisis was recognized at our conference last year. Next, we have Zara Lyons, who is also an artist, a dancer, I believe, and is the co-founder of Youth for Youth Canada, which is an organization that creates and manages projects to improve the lives of youth in Canada through arts, culture, and health education. And last but not least, I'd like to introduce Gurkirat. He is the founder of the nonprofit youth-led organization SOUDA, which stands for Students Overcoming Substance Use Disorder and Addiction Society of Canada. For the last few years, he has led his team of volunteers to set up opioid overdose response and prevention booths at community events, places of worship, and parks. Team SOUDA offers education, resources, naloxone training, and conversation in 4 languages to help break the stigma and encourage harm reduction strategies. Okay, so Taliah and Zara, I have a video that I've been told that you guys want to present. I was wondering if there's a certain point at which you want to present the video, if I should do it, if now is a good time. You guys can just...
Yeah, sure, now would be a good time.
Now is a good time, great. So I'm just going to share my screen. Okay. Okay. I think I have to share it not full screen, but here it is. It all started in the middle of the pandemic.
Everything from schools to extracurricular activities shifted to virtual interaction.
To cope with isolation, we started attending Indigenous programming to learn more about our culture. At the same time, our community, like others across Canada, was experiencing a huge increase in opioid overdoses. We heard about UBC's 2021 Let's Talk Overdose youth case competition.
Since stigma is a major barrier to people seeking help, we brainstormed about ways to reduce stigma towards people who use opioids, and we entered the competition.
Although we didn't win, we did end up as a top 4 finalist across the country. Rather than give up, we decided to spin our entry into an independent project and created Talk Overdose.
We applied for grants, created videos of guest speakers with lived experience, and brought our message to schools and community organizations focused on youth mental health.
With Indigenous communities disproportionately experiencing opioid overdoses, we thought that a different strategy was needed to reach Indigenous youth like ourselves. Residential schools, the 60s and Millennium Scoops, and intergenerational trauma were responsible for a lot of substance use in Indigenous communities. Research showed us that wellness and culture identity often go hand in hand. Since strengthening connection to culture was key to reducing use of opioids by Indigenous youth, we decided to expand our project into cultural programming.
We started a parent organization, Youth for Youth Canada, to manage Talk Overdose and our new KISAC program, and we began hosting cultural workshops in the summer of 2022.
With grants only covering a portion of the costs associated with our current Youth for Youth Canada project, we needed a way to fundraise in order to keep these projects going. So, we started selling our homemade Indigenous chocolates at community events. By creating an outreach brochure, we show how our projects directly tie to the school curriculum and to the Truth and Reconciliation Commission calls to action 19 and 55. Youth for Youth Canada is making an impact in the community.
By educating youth on naloxone, we are hoping to save more lives.
We reached 1,000 youth in 2022 and are on track to reach 1,000 more by the end of 2023.
Beautiful. So thank you so much to Zara and Taliah for that video. It was incredible, and I'm excited to hear more about some of your guys' work. Okay. I want to make sure. Okay. So I've prepared some questions to ask our panelists, but before we start, I'd just like to mention a point about questions in Whova and Zoom, just because I know it's a lot and it can be a little overwhelming. So you as audience members can submit questions to the panelists via Whova if you'd like. There's a Q&A tab on the right-hand side of the screen. And if there's a question that you'd like to see answered that has been posted by a fellow audience member, feel free to give it an upvote. And you can certainly pose your questions in the Zoom chat as well. I'm going to be monitoring all platforms, so I encourage you guys to get engaged if you wish to during the session. So I feel like now would be a good time to sort of dive right into the questions, and I think we can get started. So, panelists, you have done some incredible work to support youth. Please take this opportunity to speak about your work in your own words and what inspired you to get involved in this field. I don't know if you guys want me to call on you or if you guys just want to jump in, because there's three of you. Maybe we can start with Taliah and Zara, and then Gurkirat, you can answer afterwards.
Yeah, sure. So our project, Talk Overdose, actually started through the UBC's competition, Let's Talk Overdose, 2 years ago, so in 2021. And as the video mentioned, our Wasanaban coordinator told us about this competition. So we thought it would be for students aged 13 to 18 because it said youth, but it turns out it was against university students. However, we managed to make it to the final round, and we were against 3 other teams. After the competition ended, we decided to try to keep our project going by ourselves because we thought it could really have an impact in our community. So to do that, we started interviewing guest speakers who have lived experience using opioids and submitting those on YouTube. And then our project sort of took off from there. So since then, we've done a few school presentations and workshops for mental health summits, and it feels really good to connect with like-minded individuals and work together.
Beautiful. Thank you so much, Zara. And it's so incredible to see how that experience a few years ago ignited such a passion in you in this field. And yeah, I feel so grateful to see it come full circle. And 2 years later, and you guys are back at the conference. It's quite beautiful. Zara, Taliah, do you want to add anything to Zara's response?
Honestly, I think she covered it. So
I think she did beautifully.
I'll just take the next question afterwards.
Awesome. Okay, so Gurkirat, do you want to answer this question as well and speak a bit about your work and what inspired you?
Yeah, of course. Hi, everyone. So as we know, the death toll from drug toxicity was rising, especially after 2016 to 2018. I came here as an international student from Punjab, and I was working at a gas station as my part-time job, and I actually witnessed an overdose happening in the washrooms. And then I was going into the community and seeing people talking about this new trend in Canada, in BC particularly, where overdose rates were really high. And then I learned that there were no organizations providing culturally appropriate overdose response and prevention training in South Asian community in Lower Mainland. So then we felt a need to start a nonprofit like SOUDA. So SOUDA stands for Students Overcoming Substance Use Disorder and Addiction Society of Canada. And then we trained our volunteers. for bringing life-saving resources to our community. We focused our efforts on educating members of South Asian community, particularly in which knowledge about substance use is limited due to social taboos and language barriers. So SOUDA have been offering education resources, naloxone training and conversation in 4 languages, English, Punjabi, Hindi, and Urdu, to help break the stigma and encourage harm reduction strategies. So we designed culturally appropriate harm reduction and overdose response and prevention training, which is particularly tailored towards new immigrants, international students, newcomers, and refugees living in the Lower Mainland. And this project started without any financial support, with just one aim of volunteers to help the community and to spread the awareness around drug toxicity and overdose crisis. Yeah.
Wonderful. Thank you so much. It's incredible to see how you both groups, you noticed a deficit, something that was missing in your communities, and you decided to take action. And it seems like a lot of this was self-driven and without too much support. I'm sure that came with its own challenges and lessons. And I was wondering if you could speak a bit more about this. So what have been some of the main lessons that you guys have learned, and what have been some of the greatest challenges that you can speak on as well?
Okay, so for us at least, we did have our fair share of challenges along the way. The pandemic was a really big one. We had to figure out how to do virtual presentations and then back to in-person presentations, and then figure out how hybrid was working. And hybrid was probably the most difficult one, because we had to make sure that we kept the in-person audience engaged as well as the online one, and make sure that, we sorted all the technical difficulties. But other than that, we had a lot of trouble with not hearing back from people. We reached out to like hundreds of schools, and only a fraction would actually reply or be interested, or sometimes they would be interested, but they would want our material to be delivered by a healthcare professional. But that kind of defeats the purpose of our project, because we feel that it's very important for youth to hear from other youth. And also there are a few times where people thought, oh, well, why don't you broaden this and change your message? But the thing is, if we decided to change anything, it wouldn't really be our message anymore. So I guess just you have to remember to stick to what you want to put out, and don't really give up when you don't hear anything back. Just keep trying, because eventually you'll find some people. Other than that, I'd say also guest speakers. And that kind of ties back into stigma, because a lot of people, they're afraid to put their story out there. And that's kind of the most important part. We really need to hear from people, or else nothing's really going to change.
Thank you so much for sharing that insight and experience. Gurkirat, do you want to mention your answer as well, and then we can circle back?
Yeah, just on the same lines, we started doing this outreach in September 2019. And by December, we were having these COVID-19 clouds wandering in our skies. And by March, we had our lockdowns. But the thing is, during that time, when COVID-19 just started, we saw an initial uptick in overdose rates, especially in Surrey and in the Fraser Health region. And pretty soon, there was a report published by Fraser Health, which was suggesting that there have been more than 259% increase in overdose-related deaths, especially in South Asian men. So our team of volunteers, even though pandemic was going on its full swing, so our volunteers decided that, okay, so maybe what we can do, we can try a hybrid model. So we started tapping into a lot of radio stations, TV, news channels of South Asian community, where we went on air to tell more about overdose and how to prevent an overdose, because most of the overdoses were happening in private residences, especially in South Asian community. Other than that, our team members, they decided to hold outreach booths at various parks and places of worship in open space, so that we can adhere to all the COVID-19 protocols. And this pandemic does not hinder our life-saving work, which we were highly motivated to do. So yeah, so I think every time someone is trying to do something crucial, there will be challenges. but critical thinking and also like thinking about safety of our team members is crucial. So adhering to COVID-19 protocols, we kept our work going, and what we have learned from pandemic is the resilience of human nature to continue with the life and continue with struggles and finding good alternative solutions to the problem. So yeah, so I was really impressed with the response which we got from our community. Like I can share some of the touching stories later on in this webinar. Yeah.
I'm very much looking forward to that, Gurkirat. Thank you so much for your guys' responses. I mean, I want to echo a comment that we got in the chat from Abby that says how amazing the work that you guys are doing and how difficult it can be to stay motivated when you're facing so many hardships like the pandemic that made outreach quite challenging. And I just want to circle back and echo that your own resiliency and your own determination is what made your work possible. So my utmost kudos to you guys. I guess the next question we can kind of dive into is, you guys touched on this a little bit before, but I'd like to hear more about it. Can you please share your thoughts on the value of cultural specific work?
For us, cultural specific work is really important for what we do because it's the basis of our organization. As Indigenous people who also facilitate workshops for Indigenous youth, we believe it's beneficial for the attendees to feel connected, and it helps to have a deeper understanding of the material that we present in our workshops. So people use substances when they feel alone or disconnected. And when people have a connection to their culture, they have a stronger sense of identity and they'll feel more connected to the people around them, resulting in a better sense of well-being. So we try our best to implement as much cultural knowledge into our workshops.
Thank you so much, Zara. Gurkirat, do you want to answer this question as well?
Yeah, I think it's really crucial to provide culturally relevant and appropriate care. Does not matter which field we are working in. I think it applies to all the fields, including healthcare. So, so the major challenge we had was because people who are new immigrants or refugees or new international students, sometimes they have very limited knowledge about the English vocabulary used in Canadian context. And also people who are working in trades, people who are working in trucking industry, in construction industry, they have their own challenges. So we have to prepare our training in such a way that it is inclusive of all and without any medical jargon. So what I personally did, I consulted various community leaders, such as Gurkirat Singh from South Asian Mental Health Lyons, Dupinder Korsran from One Voice Canada, because these two organizations were working with these populations from a long time. So the way we developed our overdose response and prevention training in Punjabi, it was very easy to learn. Anyone can learn it. And even people with no educational background can actually save a life. So that was our purpose of providing these care and skills in Gurdwara, in temples, in other religious settings. Because sometimes, for example, in the beginning, there was kind of a little bit pushback from community, how come you're talking about substance use in a religious setting? But later on, we use some examples from Sikh scriptures where it actually talks about anxiety, about mental health, about substance use. And we use that to open this new outreach window in the community. And after some time, the response from community was overwhelming and it was really great. And now, for example, last week when we were having our outreach booth, if we compare the turnover from previous years, it has been increasing day by day, and people are actually sharing their stories, sharing their stories of their loved ones, how they have been touched with overdose crisis in BC, and that's actually inspiring.
I am just in awe of all of your guys' drive to continue with this work, and you mentioning your own experiences of trying to minimize the disconnect between the work and the intended people that it's hoping to serve is just incredible. And it's very inspiring for me personally, and I'm sure for many members of the audience. So thank you so much for sharing that, you guys. We are moving along our questions quite nicely. Again, I think we talked about this briefly before, but maybe we can elaborate a bit more on the topic of stigma. So can you please speak on stigma and how it has impacted your experiences?
Yeah, so I mentioned this in my last response, I think, but we had a lot of trouble finding guest speakers, and schools were reluctant to let us present to their students if they did reply. But the thing is, by avoiding the problem, we're not really addressing it, and we feel that it's just a lot better to educate youth, because our presentations and workshops, they focus on first prevention, then we go a little bit into harm reduction, and then we always end with like naloxone, and sometimes we'll hand out naloxone kits. Like, so maybe the teacher will have like a free naloxone kit at the end, but we just feel like a lot more people are dying from lack of education. So I guess stigma is kind of getting in the way of that and not letting us like help spread awareness. And because of that, I guess that's probably one of our biggest challenges, actually. But yeah, stigma is getting in the way of us finding more guest speakers, so getting different stories. Our videos will have people with different backgrounds just to prove that it really does not matter what your background is. It will impact everyone. It's not just a specific group of people.
Thank you so much, Taliah, for mentioning that. And that's a very important point that I'm sure it can be very frustrating when you're trying to do work in the community and you are constantly faced with this barrier that can kind of be disheartening over time. But again, your guys' determination is well worth the effort. So thank you so much. Gurkirat, do you want to go ahead and answer this one as well?
Yeah, so actually I can share a personal story which I heard during our outreach in Surrey. So when we were doing outreach, so this is from 2020 during COVID-19, we actually met 3 men who were all using same needle to inject substances. So we were doing this harm reduction talk with them, and then they brought this thing of stigma. They were like, oh, we have been using the same needle because if we go home with sterilized needles, our families will find these needles on us, and then they will know that we are doing drugs. And then we told them the risks associated with using the same needles like HIV or hepatitis C. And they were like, wow, we never actually knew about these risks were there. And we can clearly see how stigma is endangering life. So this is one way stigma can endanger life without education and without proper support. So then we told them about supervised consumption sites, and they were like, oh, we never knew these places existed in first place. So we can clearly see people like them are unaware of available services due to language barriers and due to lack of connectivity between the healthcare system and the general public. So I think removing the stigma and starting a dialogue around harm reduction is very crucial. And also at first, when we were going into the community to teach about harm reduction, drug toxicity, overdose training, naloxone training, so we thought we would face a lot of pushback and silence. But as we explained this concept, people actually embraced and encouraged us because they recognized the severity of the crisis. Other example, which we try to bring up during our outreach is the concept of like the accidental overdoses, because anyone can overdose. For example, there was this phone call to the BC Poison Center and a 3-year-old kid overdosed because they accidentally injected a painkiller from their mother's medication because she was on painkillers due to her, I think, hip surgery. This 3-year-old kid was showing all the symptoms of an overdose. And when they called poison center, the first thing the responder said, do you have a naloxone? So that's the importance of naloxone. So we encourage people to have naloxone in their first aid kit. For example, we have bandages, we have other stuff in our first aid kit. So I think it's really crucial to understand the importance of this life-saving drug so that we are always prepared for accidental or other kind of overdose, which are happening in the community all the time.
Thank you so much, Gurkirat, for sharing your insight and your experiences demonstrating how impactful the work that you're doing is. That's truly incredible. Thank you so much. Okay, so my next question is, could you please share your experiences with doing outreach with your community?
For us, we've gotten into contact with a bunch of schools and organizations to do presentations for our project Talk Overdose. And we've also done cultural workshops for youth in our community. So we'd rent out a room in community centers and advertise it to the public, but giving priority to Indigenous youth. And we've also done a lot of virtual presentations, which have actually allowed us to do outreach in communities all over the country. And we've gotten a lot of positive feedback from the schools who have been open enough to allow us to come present to their kids. And obviously, we're going to be still working on doing more outreach in our area locally so we can do in-person presentations this year. So far, it's been really, really hard to get responses back, as Taliah has mentioned.
You, Zara. Thank you so much. Gurkirat, do you want to share your answer as well?
Sure. Yeah, so we increased our efforts to engage our youth and members of our community, and we hold these multiple train-the-trainer sessions in addition to the outreach booths, which we do at various places. So in train-the-trainer sessions, we equip our new volunteers and public participants with a high level of understanding related to overdose recognition, response, and then with an intention so that they can educate other people. So in addition, we also conduct like online webinars related to substance use disorder, where we invite experts in the field of addiction, such as doctors, therapists, counselors, to educate the community. And we have these sessions in various languages. Moreover, other thing which I witnessed during the outreach was the lack of research, especially in the South Asian community, about the substance use patterns. So we started collaborating with research groups. And for example, right now we have been doing research, a mixed method study with Dr. Natasha Puri from Roshni Clinic on Punjabi international students and what are their substance use patterns. So I'm really excited to see when that literature comes out with new insights into the possible solutions or into what is the trend right now regarding substance use in Punjabi people. Yeah.
Thank you both for sharing your experiences, and the research that you speak about, it sounds incredibly interesting, and I'm also very excited to read up on that whenever it does come out. Wonderful. Okay, team. So this is my final question, but I see that there are a few questions from the audience. And I'd just like to end on this question that your work is very, very inspiring. And I'd like to ask, what are the most meaningful or impactful ways that community members can help or work to show up for their youth?
There it goes. My mic working now? Great. Sorry. So we feel like the most impactful or meaningful ways would be just like attending workshops or presentations. You really don't need anything other than an open mind and a positive attitude. If you really want to do more, maybe help them find opportunities to reach more youth. For example, like space, like ways to volunteer, vendor opportunities for people who are like having to fundraise for their projects like us. Maybe donation materials or time, or honestly just sharing resources. Anything is helpful, but I feel like the most meaningful thing you could do is just to participate in one of the events.
Thank you, Taliah. Gurkirat, do you want to answer this one too?
I cannot agree more on what Taliah has already said. One thing I would say is also kind of appreciating the volunteers for their time and for the work they have been doing. And also, yeah, being there to attend these sessions and then spreading the word around their family members, around their community members, and do not hesitating from us asking for help if they need it. So yeah, so I think like breaking these barriers and promoting more care and empathy and love within the community to tackle this deadly crisis is the key to help people who are vulnerable and who are suffering.
Beautifully said. Okay, so that's all my questions that I had pre-written for this panel. I'm going to move on to, I saw a few questions in the Whova chat, but now I invite the audience members to take their time and ask our panelists any questions that they wish. In the meantime, I'm gonna go ahead and ask you guys the two questions that we have. So the first question is from Tal, which asks, how do you balance these projects on top of going to school? I think that's a very valid question if you guys want to provide any insight.
At least for us, what we do is we basically work on this in our spare time. So holidays, evenings, weekends, stuff like that. But it is pretty difficult. It does take a lot of time. But we also have like little spreadsheets to track everything so that we know when we're doing things and when we can't.
Wonderful. And Gurkirat, what about you? Do you have any wisdom to share?
I think, yeah, I cannot agree more what Taliah already told. Like knowing your boundaries is pretty important, and knowing when you can do it and when you cannot. But sometimes there are situations when we do not have any option other than to helping a person. For example, recently we have been working with an international student who is homeless, and he is having like a lot of challenges and no support from the community or other people. So then I think it becomes a moral responsibility, and you have to push yourself a little bit harder despite of your personal challenges as well to save a life. So I think that's what keeps us motivated to help people and to push for their rights and advocate for their well-being, like going to meetings, taking time out to talk with community leaders so that we have appropriate resources in place and we have a system in place so that people do not fall through these cracks which are already there. So I think, moreover, I have never treated it as a volunteer work, but more like a responsibility I have to help my fellow community members. So yeah, so sometimes it's pretty tough, but the happiness which we get from helping others and from seeing a positive impact in the community keeps us moving.
That was so beautifully said. Thank you, Gurkirat. Your guys' dedication to the work that you do is beyond inspiring. So I guess that kind of trickles into our next question from Arisha that asks, what advice do you have for other youth who want to get involved in this work, having gone through the experience yourselves?
Our biggest piece of advice is not to give up, because if it's something that you believe in and you feel it can make an impact in your community, it doesn't matter if you're winning a competition with it. If you believe in it, you can take it somewhere as long as you're willing to put in the work and you feel you have the support around you that you need to succeed with your projects.
Beautifully said.
I don't know if you have anything you want to add, but that's all I have to say.
Okay, my mic is okay. We're basically an example of that because we didn't win this competition and we really had no project set in place when we first started. We just had like the 1 week of research that we did and like our 5-minute video. And from that, we just started building and looked for other organizations who'd want to collaborate. And you just really have to take something that you believe in, and then the rest kind of falls into place. But you just need to not give up when you don't hear anything back right away, because it will take a while.
Beautifully said. Thank you guys so much for sharing. Gurkirat, what about you?
From my personal experience, I think if you have something in mind and you want to start a program or something like a cultural intervention for your community, do not hesitate to ask for help from the community leaders. Just send a small email, and that one email can change the entire pathway. So always be ready to accept the feedback, to ask for help, and do not hesitate to send emails, which I always do.
That's a great piece of advice. And I can also attest to that one as well. Wow. Okay, beautiful. There are quite a few questions in the Whova chat. So the next one is, have the adults in your life, such as family or teachers, always been supportive of your work?
Our parents have been very supportive, and for anything that we haven't been able to take care of, they've pitched in with, because they're like, for grants and stuff, there's an age limit, like you have to be a certain age, and we were all like under 18 at the time that we first started, so we had to have a little bit of help with the grants. But we've had a lot of support.
That's lovely to hear. I'm so happy. What about you, Gurkirat? Do you have anything to add?
Yeah, so I think elders, for example, my grandma. So whenever I have like some kind of situation at the outreach booth, I always consult her feedback as well, because she's elder. She knows about the community. She knows about how things works, especially with older adults. So I think having a good connection with family, they can actually guide us in a right culturally appropriate direction. So yeah, so I love to spend time with her, and I always consult her. Let's say we have a new intervention for the community where we want to involve older adults. So I would love to hear from her perspective how this intervention should look like. So yeah, so involving parents, involving elder community members is really crucial for designing appropriate interventions.
Wow, that's so great to hear that you have someone who can kind of advocate for the group that you're working to support in your life, Gurkirat. I'm very glad that you have such a supportive figure, and for you, Zara and Taliah, as well, that you guys have wonderful parents to support you through this journey, because I can't imagine how much work and frustration and joy and all of it goes into this. So I'm really happy that you guys have such wonderful support systems. The next question, I'm going to look to the Zoom chat. It's a question from Abby that asks, this is a really great question. What are some hopes or dreams that you have for your organizations?
We're hoping to involve more youth in our project, because right now there's only 4 of us who are running this whole thing. And as we're getting older, we have a lot of stuff going on, and it's growing to more than just a grassroots organization. So we're hoping to involve more youth and present to more schools in our area, try to build more in our community, and then spread to the rest of the country. Taliah, anything else?
No, I think that's basically it. Maybe partner with some other organizations, because I feel like collaborating with other youth-focused organizations would probably be very beneficial.
Wonderful. Glad to hear it. Wonderful. Gurkirat, do you want to answer this one as well about your dreams?
Yeah, just on the same lines. Firstly, we are actually working on creating a video resources in Punjabi and Hindi for overdose response and prevention training, and hopefully expanding the work SOUDA have been doing to the other provinces as well. So like a Canada-wide network of our volunteers where they can go to places of congregation and tell people about the overdose crisis, because whether it is Toronto, whether it is Vancouver, the problem is same. The challenges are same within the South Asian community. Yeah.
Beautiful.
So, thank you.
Well done. Yeah, I guess one of the points that it can be overlooked when you're a youth and you're doing work from the field is how, if you're successful, it can grow into something really big, and that's wonderful, and that's the goal. But then also with that comes the responsibility of navigating that and how to sort of go about organizing it alongside all of the other work that you guys are doing. So I think that's just a testament to how incredible you guys are. And yes, okay, so I think there was one more question in the Whoova chat that I might have. Oh, this is a really good question. Someone mentioned feeling pressure to change their message. I believe that was Taliah. What's it like being a young person trying to navigate systems that think it knows better than you do?
It's definitely very frustrating because, again, we were like a bunch of kids trying to speak about the opioid crisis, and then there'd be people with like PhDs and people who would, I guess, have more experience in the medical field telling us, oh, you should focus on not just opioids, but this problem and that problem. But I feel like you really need to start with just one problem before you branch out and make it too vague, because you can't solve everything all at once. And the opioid crisis is not going away. It is just becoming more and more of a problem, and it's affecting more youth as time goes on. So it's really very frustrating when people are telling us that we should change it, but we know what we want to do, and we're not going to be changing our message.
And also, it's really important to have youth-to-youth communication, because when you're hearing things from a nurse who comes to talk to your school, personally, when people would come talk to me, I wouldn't pay as much attention because I can't relate to them. They're someone who's gone through their whole life. It's not someone I can see myself in. So it's really important to have kids talking to other kids to get them to understand the message.
Totally. I think that having someone that looks like you and has experienced the same experiences and can relate to you kind of minimizes the disconnect that you feel when you're in a space of trying to educate yourself or educate others, and just to learn and grow. So having a sense of connection with the audience or the group that you're hoping to help is really important. And I find that that's something that I take into my work too, is trying to create an environment that is like accessible and welcoming and relatable, really, because at the end of the day, that's how we know that we can be really impactful. So thank you so much for mentioning that. Gurkirat, do you want to also share?
I think they shared all the points I was actually going to share, but I have one thing to add.
Yes.
In addition to telling youth how to deal with overdose crisis, one thing we have been particularly working is providing the youth the tools for advocacy, and like bringing in community leaders to tell them how to write a letter to the MP or MLA to address a particular issue in their community, and also like passing whatever we have learned to the next generation so that they get equipped with all the tools and then they can start on to their project. And then that's how the cycle will keep going in our coming generations. So yeah, so thank you so much for having me today, and perfect.
Pleasure. Yeah, of course. That is a very insightful comment that you've made, is how can we sustain the work that we're doing for future generations? That's not something that I think most, people are really thinking about when they're, especially someone like as young as you are. And I am very inspired by how, I guess, deeply you've thought about this and your introspection here. So that's really great. Thank you so much, Gurkirat. So there aren't any more questions that I have seen in the chat. If the audience members have any questions they'd like to ask this incredible panel, I encourage you to do so. I'm personally learning so much from these incredible people, so feel free to ask your questions. You can also unmute yourself if you want to if you feel comfortable to, and ask them that way, or if you want to give any feedback to the team or thoughts, it would be well appreciated. I have a really great question. It's from Tal that asks, have you heard back from participants or audiences about what your work has meant to them? Have you gotten any feedback that you'd like to share?
We've had a few people reach out to us and either share stories about someone that they knew or personal stories. A few times. I don't really know how to get into it, like going too much of a tangent, but
that's all right.
Yeah, we had some pretty good feedback, and we had a lot of people who appreciated the work we've done or suggestions, which actually we've taken a few times to be able to improve our projects, because again, we're open to learning about what the best ways of getting the message out there would be. We're not necessarily focused on just doing it our way or the highway. Like, we want to make sure that this is something that's going to actually be helpful.
Yeah, that's great. I think being so open-minded and able to adapt is such a key aspect of having like a successful doing work successfully. I mean, when you're someone in of your guys' age and experiences, it's kind of tricky to know what the right move is at all times. So I think it's very wise of you guys to be so open to feedback and incorporate that into your work as well. That's great. Gurkirat, what about you? Do you have any thoughts here?
So we trained this lady in 2021. She came to our booth and she learned how to use an naloxone. And few months later, she came back. She was visiting Gurdwara and she stopped by our booth and she said, I used your naloxone kit to save a life in Vancouver. That was huge. So she told us, okay, this time give me 2 naloxone kits because I have already used one. So that's the impact which we want to see. People willingly coming to us and asking for naloxone kits because they're saving lives, and providing them tools and courage to save a life. I think that's one of the success stories I really want to share today. So in terms of gauging the effectiveness of our work, so we are trying to set up some like research studies as well in knowing how effective our community outreach is and what we can do to even improve it further, because gauging the effectiveness is really crucial so that our work is sustained in the long term and we make adjustments according to the changes in the demographics or changes in the other factors which affect our community.
Wonderful. Thank you so much, Gurkirat, for sharing. That's a very touching story of how not only, I like how you said providing the tools and the courage. That is something that's very inspiring to me personally, and I'm sure for our audience as well. So thank you for sharing your insight there. Are there any other questions from the audience? You guys are asking some incredible questions. Thank you for being so engaged and active during this panel. And Gurkirat, someone asked about your website and so they can learn more about you. Does Team SOUDA have a website, or is it mainly on social media platforms that you guys?
Our website, actually, it's like under construction. So hopefully, within like next few months, we will have a website. But we are on Twitter and Instagram, and I will just post the link in a second.
Wonderful. Yes, I see that you guys are quite active on your social media platforms. So it's really great because you get to see. You get to get like a good idea of what the work that you do looks like. And I think that's really, really cool that you guys share it so thoughtfully. Wonderful. Okay, so we have another question from Marisha, and it asks, how can other organizations support you? Do you guys have any thoughts there?
Yeah, so for example, we've been collaborating with Starlings a lot, and one of the founding members of Starlings is actually a nurse. So she was able to provide us with some more recent research, some stats, and like help us like kind of fix our slides so that our workshops were a little more interactive and up to date. So I guess just maybe having another organization to help promote your stuff and you promote theirs in return, and just like critiquing each other's work. That's probably the best thing you can do.
Yeah, working with her organization, she offered a different perspective because she did have personal lived experience with parents who use substances as well as the medical experience that she had. So she offered different perspective and her opinions on our project, and she kind of helped us understand the importance of the cultural specific work, which has helped us work more on our workshops and make them more helpful for you guys.
That's wonderful. I'm so glad to hear that you guys had such a supportive figure of an organization to guide you through this process. Thank you so much for sharing that, you guys. Gurkirat, do you have any thoughts on how organizations can help you in your work?
I think the work we have been doing will not be possible without the help of other organizations such as One Voice Canada, which is an organization for international students, Guru Nanak Food Bank in Surrey, Guru Nanak Free Kitchen, Khalsa Aid, South Asian Mental Health Alliance, Moving Forward Family Services. So by coming together in the realm of all these organizations, we actually formed a mini hub of resources. For example, if we have someone who is coming to our booths, they're having food insecurity, so that we can easily link them up with Guru Nanak Food Bank, so their nutritional needs are solved. And let's say we have a guy who is homeless and they're looking for a shelter, then we actually know who to reach out in Surrey. So all this work is being done in collaboration, not only overdose response and prevention, but also the other factors which a person needs. And similarly goes on their end. If someone comes to them, let's say One Voice Canada, an international student who wants some more knowledge about overdose response and prevention training, then they can link them with us. So it's a very collaborative environment. And I think the more collaboration we can do with our fellow organizations, the work will be more impactful, and it can be done at the broader level.
Yeah, wow. Thank you so much for sharing that. That's a really important point that I have kind of learned as well through my work, is how oftentimes people need access to like a continuum of care. So when someone's struggling, it's not, as you mentioned, it's not just with substance use. It can be with mental health. It can be with, violence they face, trauma, experiences that they've had that kind of led them to be marginalized in some capacity. So being able to collaborate with others and sort of liaise them to other resources, I think is such a superpower of your guys' organization. And it's incredible that you have these connections with other groups and are able to support people in a very meaningful and tangible and like full way. So that's really great that you mentioned that. Thank you so much. Okay, team, so we only have about 5 more minutes. I think we have time for one more question if anyone in the audience has anything to share or anything to ask. Now's the time. We had a really nice comment from Tal. Thanks, Tal, for your engagement. That says, it can be tricky to know who you are, but still be open to growing and learning. Great job. Couldn't have said it better myself. Thank you. Thank you.
There is one thing I'd like to add if there are no other questions. A lot of people don't know this, but you can get a free naloxone kit every year. You just have to go to your local pharmacy and you can ask the pharmacist to train you. And as long as you have a health card on you, you can just get one as you walk out.
Yes.
And actually, if you use it, you should be able to bring back the kit and they will give you another one. But yeah, you just got to prove that you actually have used it, but it doesn't actually cost money.
That's true. Thanks so much for sharing that, Taliah. That's a really important point. And I think it's not very well known that you can get naloxone pretty, hopefully, easily. And yeah, she went ahead and shared a resource from the Canadian government website about naloxone. So feel free to check that out. Okay. It looks like there aren't any more questions from the audience. I just want to take this opportunity once again to thank you, all three of you, so much for your time, for your words, for sharing your stories. I have to say that I've been coming to this conference for a few years now, and this has been one of my favorite experiences to be able to talk to you guys. I feel so inspired. So thank you so much, everyone. And thank you so much to our audience for your brilliant questions and for your attention and for your presence.